This video will cover primary cutaneous DLBCL of the leg, DLBCL associated with chronic inflammation, and EBV-positive DLBCL not otherwise specified. To anchor ourselves to the fact that this video refers to DLBCL, we have, just like in other DLBCL videos, the basilisk character. But since this video covers 3 different DLBCL entities, there are 3 of them. Remember that basilisks are diffuse, large, and their name starts with a B. Oh, and they're green, which helps us remember lymphoma since lymph things are usually represented in green. Let's cover these one by one from left to right, because we're not psychopaths. The first basilisk here is struggling. It's coughing up some serious mucus and purulent material. This is to remind us that this portion of the image refers to DLBCL associated with chronic inflammation, and that the classic scenario is a patient with long-standing pyothorax. As any sane and normal person does, this basilisk is watching TV while sick. While being and feeling sick is terrible and I don't wish that on anyone, there's a strange comfort that comes from passing time by watching TV when sick. Especially if it's something boring, puts you right to sleep to forget about how crummy you feel. Anyways, back to work. These neoplastic cells express EBV. As in other videos, EBV is represented by episode 5 because if you shorten the word episode, you get EP, and the number 5 can be written in Roman numerals as the letter V. All of this will spell out EPV, which is so similar to EBV. So this basilisk here watching episode 5 of its show here on this TV will represent positive EBV. That's it for the first one. The next DLBCL entity is found here in the middle of the image and is the EBV-positive DLBCL. I'm not going to repeat the EBV stuff since we just talked about it and it's in the name of the entity. This neoplasm is classically seen in older adults, specifically in the Asian and Latin American population. And you guessed it, that's exactly why we have this character here. And hey, it's almost 2026, let's not judge. If someone identifies one way or the other, that's totally fine. The last thing to remember about this one is the fact that typical morphology is polymorphous with large transformed and even Reed-Sternberg-like cells. To represent Reed-Sternberg-like cells, take a look at the computer game the basilisk is playing. If you're a cultured person, you'll know that this is one of the greatest games ever made, RuneScape. RuneScape is often shortened to RS. Because of that, we'll remember RS, or Reed-Sternberg cells. Okay, last one to cover. So, of course, this one is the primary cutaneous leg type of DLBCL. To anchor us to cutaneous, look at the skincare product the basilisk is holding and offering to its friends here. Now notice this mother here. The mother represents positive MUM1. Take a close look at her legs though. They're tied up by a belt. This is to represent BCL2, since belts have buckles, which sound like BCL. And to represent the number 2, just remember that this belt is right next to her shoes, which number 2 sounds like shoes. An additional prompt to remember here is the fact that since the belt is on her lower extremities, the classic site for this neoplasm is of course no other than the lower extremities. As in other videos, there's some type of den back here. Sometimes these dens in other videos are full of CDs to represent positive CD10. But since this den is empty here, it represents the expected negative CD10 in this neoplasm. Lastly, this neoplasm is associated with the elderly population, which is why we have a grandma sitting here next to the mom.